We talk a lot about matters of the heart in February, not just because it's Valentine's Day, but because it is Heart Month, which also includes Cardiac Rehab Week. Dietitian Katie Sheely and exercise specialist Joyce Hagee from UT Health, East Texas Rehabilitation Center, join us now. Thanks so much for being with us.
Hi there.
Well, I want to start with what is cardiac rehab and the components of that for people who don't know.
Well, the main components of cardiac rehab are the core component is exercise training. We also provide education regarding risk factors. There's counseling and support for stress management. And we do a lot of risk factor modification working with the healthcare professionals regarding blood pressure, cholesterol, blood sugar.
So it's a big program. Also tell us about your program, Pritkin's Intensive Cardiac Rehab, that's offered at UT Health.
Of course, yeah. Our program is a Pritkin Intensive Cardiac Rehab program, and we're one of the only facilities that offers this type of program in the area. So that's going to include patients coming to work out for an hour 3 times a week. And they're also going to get some type of education while they're here. The core pillars of Pritkin are going to include that exercise as well as a healthy mindset and a healthy diet and stress management. So their classes are really going to be focused on that. We do a cooking school every week, learning about heart healthy nutrition following this Pritkin diet. And they take classes from doctors who work in the psychology department and really get a really well-rounded educational component because of our Pritkin program.
So who ends up in cardiac rehab? That's a question I'm sure a lot of people are asking, like, why do I need to know this? What are your patients like? Are they people that have just had heart attacks or other things as well?
The qualifying diagnosis for cardiac rehab is going to be if you've had a heart attack, if you've had a coronary artery bypass grafting, also known as a CABG surgery. We do angioplasty or stent placements. There's heart valve replacements, stable angina for chest pain. We also have some heart transplant patients as well.
So I'm sorry, go ahead.
And to qualify, your physician, your primary care physician, or your cardiologist will need to do the orders, send the order in if you have one of these qualifying diagnoses.
How can cardiac rehab potentially reduce the devastating effects of heart disease for a lot of the patients that you see?
Well, it improves your physical fitness. We do a gradual increase. We start with a light exercise and slowly progress you. We also manage your risk factors like your high cholesterol, blood pressure, if you have diabetes. We provide psychological support with stress management. There's also the education component and lifestyle changes. And we basically reduce the risk of any future cardiac events.
So we talked, I'm sorry, go ahead.
One of the greatest benefits that we see too really is the community aspect. For a lot of these people, it's a huge life change to go through this cardiac event. And so coming here, you're going to be surrounded by people who have had a similar experience and they're committed to the change that we're working on here together. And what I hear from so many of our patients is that having people around them doing this together is a huge impact for them.
And you talked about this being sort of a team effort, not just with the people that they may meet in cardiac rehab, but one of you is a dietitian, the other an exercise specialist. How many people are coming on board in this cardiac rehab program that they're going to see when they come see you?
It is a group of healthcare professionals. We have the exercise specialist or exercise physiologist, which we start their program. It's a personalized exercise plan. So it's not everyone fits in one box. So we are looking at their individual needs. We also have a registered nurse, our dietitian, Katie. The cardiologist or your physician is overlooking the program. They're not in the day-to-day interactions, but they're their medical supervision. And then we also have the counselor or mental health providers.
I would imagine that when you have these patients in here, you're having to watch them much more closely than if you were just at a gym doing your regular cardio, because you have a lot of factors to consider.
Yes, we have with your blood pressure, we're looking at your blood sugar. We're making sure that your heart rate is within range. We're watching your EKG while you exercise. So it is a very overall holistic approach while you're exercising.
It's a much safer way to return to activity after this type of cardiac event, because they are watching these patients constantly while they're here. They're hooked up. We're seeing their EKG. And there have been times where you guys have had to send patients down to the ER because we're seeing things like a blood pressure is too low or a heart rate is too low.
Yes.
So having that team makes it so much safer.
Yeah, we follow the specific protocols for blood pressure readings, for blood sugar readings, heart rate. We make sure everything is within range. We don't like to send news to your doctors unless no news is good news. So unless there is something seriously going on, we just try to work with it in the gym. And we want you to hopefully get back to feeling like your old self again. That is our goal, to kind of be able to do these things on your own once you leave. So it's a 12-week program.
It's got to be comforting to the patients who have been through a traumatic event, learning about heart disease or having a heart attack, to have you guys there while they get back on track.
Yes, we do a personalized plan, and they meet with our physician every 30 days. It improves their overall quality of life, and ultimately by going through cardiac rehab, it decreases your risk of having a future heart condition. And honestly, you are regaining your confidence in your life again.
Yeah, I mean, it's talking about coping with heart disease. I can't really imagine. I know it must take a toll on patients. How important is that support at home as well during this time?
Support at home is extremely vital for the program. We have a lot of spouses and family members that attend our Pritikin education classes. It's very important. They provide the emotional support. There's motivation for the adherence of the program. They provide practical assistance, monitoring your health at home. Stress is a main component that we've talked about, and so having a stress-free home life is very important. And it also provides accountability and communication. A lot of the heart patients don't want to tell you when something is going on, but the family member is there to provide us what's going on at home, how they've been feeling, things of that sort that maybe the patient isn't paying attention to.
Yeah, it sounds like a team effort. Well, yeah. We talked about it. It is Heart Month, and heart disease is the nation's leading cause of death. So something like cardiac rehab is crucial to survival, it sounds like, and something patients need to take very seriously. How about what people should know before a cardiac event ever happens? What should people be doing, listening to their bodies? What should we know?
It is very important to have preventative measures in place. Understanding your risk factors, knowing your numbers, knowing your blood pressure readings, your cholesterol, have a yearly lipid profile, knowing your blood sugar, knowing your A1C. Know the symptoms of a heart attack. Be aware of any odd symptoms, nausea, dizziness, sweating. Chest pain is the most common effect, or pains in other areas like your jaw, your shoulders, down your arm. Between your shoulder blades. Keep your regular checkups with your primary care physician and your cardiologist, and keep an eye on your lifestyle choices. If you're a smoker, try to decrease smoking, limit your alcohol intake, watch your dietary choices, and really know how to respond if there is a cardiac event. CPR certification, know what to do in an emergency. And very importantly, take your medications as prescribed. A lot of patients if they are not feeling well, they'll stop taking a certain medication. Don't stop taking unless your physician is aware. Very important.
Yeah, we talk to so many people who say, I didn't think this symptom was severe enough, and I'm so glad that I went to the ER for it. Or I had no idea that there was anything going on with my heart until I went to my regular checkup and they did a stress test. And so really being diligent with keeping up with those preventative care checkups, getting your physical every year can make a huge difference, because catching these things early is the best way to prevent a more devastating event in most cases.
What is the most rewarding part of your job in working with these patients?
It is, we actually talk about that day in and day out, how much we all absolutely truly love our jobs here. We work as a great team. We all get along with each other very well, and we love our patients. Everyone seems to have a lot of fun here. I just had 2 patients yesterday exchange phone numbers to go to lunch. It becomes you're surrounded by people that are going through a very similar situation, and lifelong friendships are formed here. So it is a really nice, fun environment.
This is a unique opportunity too. We get to spend 12 weeks with these patients. And so it's so rewarding to see the growth from their first day showing up being sometimes terrified to get on a treadmill or get on an exercise equipment, because they've just had this huge event happen in their lives.
Yeah.
And by the end of the program, they are sad to go. They are beating all of their records physically from, their initial assessment, and typically just feeling so much better, so much more confident and more safe. And I think that's something that we get to provide.
And we love that with the Olympic Center, if they graduate from the Pritikin Intensive Cardiac Rehab Program and attend all of their visits, they get actually 2 free months to exercise at the Olympic Center. So that's also very cool, because we don't have to say bye to our patients. They continue to exercise and check in with us and see us day in and day out. So we really enjoy keeping up with our former patients as well.
Well, thanks so much for enlightening us a little bit about the importance of cardiac rehab once you have an event in your life, and just Heart Month in general. I appreciate it.